Tetanus is a neurological condition that is caused by Bacillus clostridium tetani. This is a bacteria that usually enters the body through a wound. It then releases toxins into the blood that interfere with the release of neurotransmitters. This is what leads to the symptoms of tetanus. Descriptions of tetanus have been recorded since 5th century BCE, but it wasn't until 1884 that the etiology was discovered by Carli and Raton. They injected animals with pus from a human tetanus case. Nicoler also produced tetanus in animals by injecting them with soil. Years later, antibodies were discovered that can neutralize the toxins that are produced by this bacteria. This discovery led to passive immunization that was used during World War I. A tetanus toxoid was also discovered that became widely used during World War II. Since the tetanus toxoid was introduced as an immunization in the United States in the 1940s, the incidence of tetanus has greatly decreased. In the 1940s, there were approximately 500 to 600 cases of tetanus a year. Between 2009 and 2012, there was an average of 29 cases reported a year. Death rate from the disease has also dropped from 30% to approximately 10%. In 2014, globally, there were 11,367 cases of tetanus. Older adults are at higher risk for tetanus than young persons due to their inadequate vaccinations and inadequate wound prophylaxis.
Transmission is unlike many other diseases. It is not spread from person to person, but from objects that break the skin's barrier and enter the bloodstream. Objects are normally dirty with soil, dust, and animal feces embedded in them. If the skin has these things already on them, there is a chance that animal and insect bites could provide entry of bacteria. Examples of how tetanus enters the body include puncture wounds, gunshot wounds, burns, injections through IV drug use, and compound fractures, all of which break the skin's barrier, allowing entry of this harmful bacteria. An example of transmission would be if someone steps on a dirty nail that had been laying on a garage floor for some time. It probably accumulated some kind of dirt, dust, and manure, and is now introduced into the bloodstream.
Tetanus is sometimes referred to as lockjaw because the first symptom seen is contracting of the jaw muscles. The muscles become so tight the person cannot open their mouth. This muscle stiffness travels down the neck, making it hard to move the neck and causing difficulty swallowing and breathing. The muscle stiffness will then move down to the stomach muscles. Contractions travel through the trunk of the body before moving outward to the arms and the legs. Patients may experience muscle spasms that last several minutes, and these can continue on for several weeks after the initial exposure. The telltale muscle contractions and spasms are often accompanied with fever, sweating, increased heart rate, and blood pressure.
Unfortunately, there is no cure for tetanus. However, there are a number of medications used to treat the signs and symptoms, such as antitoxins, which are used to neutralize the free-floating toxins in the body that have yet to attach to tissue. Antibiotics are used to fight the bacteria. Sedatives are used to relax the pulsable muscle spasms. And then general wound care is important to clean out the necrotic tissue and foreign objects. There are some serious complications associated with tetanus, such as infection, hypertension, pneumonia, aspiration, fractures, and worst-case scenario, death. Thus why prompt treatment is needed for the best outcome. On top of med regimen, occupational and physical therapy are used to improve activities of daily living. Hand hygiene and overall hygiene is also key for optimal healing and full recovery.
Fortunately, there are vaccinations to help prevent tetanus. The DTaP vaccine is given to children in 5 doses at 2 months, 4 months, 6 months, between 15 and 18 months, and then the final dose is between 4 and 6 years old. This protects against diphtheria, tetanus, and pertussis. Around 11 to 12 years old, adolescents will receive a Tdap vaccination, and this vaccine is also given to pregnant women during their 3rd trimester. Everyone will receive a tetanus booster shot every 10 years and any time tetanus exposure is suspected.
As stated previously, there is no cure for tetanus. However, with prompt treatment, the prognosis is very good. Without it, 1 in 4 people can die. A nurse who is caring for a patient with tetanus will want to maintain airway by watching the use of accessory muscles, nasal flaring, grunting, and lung sounds. Cleaning the mouth and throat of any secretions and giving oxygen as ordered by physician to prevent hypoxia and permanent damage to the tissues of the body.